Good morning, myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the MFR, in which we'll talk about the application of the myofascial release. So first are the gross stretch of any muscle. Using the ulnar border when more precise pressure is needed during a gross stretch. Later surface of the thumb can be used for precise pressure. Note, although initial stretch is applied in the line with the muscle fibers, responding to feedback from the muscle may cause a change in the direction of the stretch. Gross stretch of the small muscles. For small muscles like masseter and anterior deltoid, only one or two fingers of each hand are needed. One hand proximal to the distal attachment of the muscle to be stretched. Horizontal stretch is applied and sleeping is prevented. So this figure shows the gross stretch of the small muscles. For example, masseter. So gross stretch of small muscle using two fingers. Gross stretch of small muscle using one hand. Next is the vertical stretch. Any stretch applied perpendicular to the fingers of the target muscles using an upward lift or downward pressure is a vertical stretch. Biceps brachii, brachioradialis, gastrocnemius, iliacus can be stretched this way. In this stretch, muscle attachment provides stability force. Muscle stretch can also be given by two fingers reinforcing each other or using one finger. Next is focus stretch of any muscle. It is used to stretch a small segment of the muscle to take up the available slack. Focus stretch can also be given by using two fingers or using two fingers reinforcing each other. Next is variation, self musculofacial release, that is SMRT. It can be using by foam roller, lacrosse ball, etc. Work on the principle of autogenic inhibition. When muscle tension increases to the point of high risk of injury, the Golgi tendon stimulates muscle spindles to relax the muscle. The relaxation is autogenic inhibition. The muscle contraction which proceeds to passive stretch stimulates the Golgi tendon organ, which is turn causes relaxation that facilitates this passive stretch and allows for greater range of motion. Next, during practical, first we do the practical assessment, skin rolling, palpation check by tissue drag, tenderness, tissue rebound or temperature. Type of myofascial release can be used are longitudinal release, transverse release, cross hand release, traction and compression. And should be noted the possible red flare and sudden outburst of emotions. Thank you.